The management of the Federal Medical Center Abuja has listed a number of challenges affecting its services. Chief Medical Officer of the Hospital Board, Dr Saad Ahmed, says a constraint of space is one of the major issues hindering smooth operations. Dr Ahmed said this during an oversight function by the House of Representatives at the health institution. FCT correspondent Nomi Oloribe has the details.
Prof Saad Ahmed, Chief Medical Director, Federal Medical Center Abuja, while receiving the committee members on health institutions from the House of Representatives, said lack of space is one of the major issues affecting the medical center. Professor Ahmed said the hospital is working towards opening a cancer care center, but there is no land available to build on. He further listed issues like lack of manpower, cost of energy, as well as other challenges as problems limiting their services.
First and foremost, I must say cost of energy is quite high. What we pay AEDC and what we pay for diesel is quite high in this place. And we don't allow a second for us to stay here without lighting any part of this hospital. That's number one challenge. Number two, we are constrained by space. There are a lot of services that we want to introduce. For example, cancer care, but we don't have where to even site the bunker. If you look at this place, everywhere is congested. Even where people will park their cars to access service, even where the staff can park their own cars, is also a very big challenge.
Amos Magaji, Chairman, Committee on Health Institutions, during his address after touring the medical center, said the National Assembly is working towards the reversal of medical tourism. According to him, improving the medical system in Nigeria so patients from other countries who visit the nation for treatment is a top priority at the 10th Assembly.
We will be able to secure this land for this hospital. It is my greatest desire. The land is secured for the hospital so that you just blow and do whatever you want to do here. I can see the innovations that you are bringing into this hospital. And then we don't want a situation whereby you are now putting structure here and there before you now have the land. It will affect planning and then functionality of the hospital. If you put structure because you don't have space, and then space now comes, there are areas where you can't uproot those structures. But if you had that space, you will have put them in those areas. So we want to do it very fast so that you go back to the drawing box and have this hospital redesigned the way you truly want it to be.
The medical director also expressed concern on the need to pay attention to health emergencies in Nigeria. From the nation's capital, Naomi Oloribe, ADBN News.